This lecture is about the cerebral palsy, where the cerebral refers to the brain and a palsy refers to the disorder of the movement or posture. So, what happens in cerebral palsy is that it has impact on a person's movement. There is a wide range of movement impairment, and how severe movement impairment is, it depends on where the brain is damaged and how severe it is damaged. There are three main movement centers, and there are three associated tracts of neurons that used to communicate with these muscles. So, if anyone there is damage or impair, that's how you get a cerebral palsy. So it depends on which of the movement centers is primarily affected that give rise to different type of cerebral palsy. So in cerebral palsy, one's ability to move is disturbed. Not everyone with cerebral palsy looks the same. So in cerebral palsy, affect people in different ways because different parts of the brain can be affected. So it has impact on a person's movement because messages coming from the brain does not reach the muscles in a correct manner. So what are the causes of a CP is that there may be the injury to the brain can occur before, during or after the birth. There may be a lack of oxygen, toxic injuries, or poisonings which may be used by the mother during pregnancy, head trauma from the birth injury. There may be a fall and a car accident, infections of a nervous system, and a baby's mother may have infection during a pregnancy. She may have a germinal measles, shingles, influenza, faulty blood supply to the brain, and there may be a genetic disorders and there may be a chromosomal abnormalities which can lead to a cerebral palsy. First one is a spastic cerebral palsy. The most common type of cerebral palsy is a spastic, or which is known as a stiff type of cerebral palsy. 70 to 80% may have a stiff type of cerebral palsy. So it is due to damage or impairment of a motor cortex. So motor cortex help us to plan, it helps us to control the voluntary movements that we want to make. So in order to accomplish the voluntary movements, the motor cortex uses special type of neurons called as upper motor neuron. So these upper motor neuron come from different parts of a motor cortex, and with the neighboring upper motor neurons they form a pyramidal tract. So motor cortex uses upper motor neuron to control our muscle. So when motor cortex itself or pyramidal tracts, that is the upper motor neuron, are damaged, some of the muscles will not be able to get the right messages from the motor cortex. So as a result, what happens is that there is a increase in a muscle tone, there is increase in a resistance, there is a decrease in a movement. It means that there is increase in a muscle tension. Increased muscle tone make muscles really tight, so stiff and difficult to move. And this type of cerebral palsy is caused by damage to the motor cortex or upper motor neuron in our pyramidal tracts, known as a spastic cerebral palsy. Sometimes both sides of a lower body are affected by stiffness, so some muscles become more active than other muscles in that area. Like for example, muscles in the inner thigh, these muscles are used to pull the thigh together and rotate them inward. So when someone there's a motor cortex is damaged, so what happens, the knees start to cross over each other like the scissor and often called as a scissoring gait, and these overactive muscles are very stiff. It is very difficult for the person to get out of these positions. Another pattern we commonly see in persons with spastic cerebral palsy is that they walk around with their toes because calf muscles get very tight and they pull the heel up, so a person walks on toes. Stiffness can also appear on one side of a body, so the patient will have gait problem on that side, like a scissoring gait and a toe walking. Some Same happens with the upper extremities. Muscles that bend the elbow, wrist, and the fingers become really active. So sometimes The muscles of a tongue, face, and a vocal cord are also affected, which make it hard for the person to eat, swallow, and speak. Next is the ethetoid dyskinetic cerebral palsy. So this is caused by damage to the basal ganglia. Basal ganglia helps to initiate the movement that we want to make and prevent movements that we don't want to make. So they use extra paramedial tracts to send messages to other structures in the brain. So when these tracts are damaged, basal ganglia can't really do their job to prevent the unwanted movements which result in involuntary movements to occur. So these involuntary movements can be a twisting. So person arms and legs can get twisted when they try to move, and this twisting can get person in a very uncomfortable and a painful positions. Involuntary movements can be clenching of fingers, making very hard for a person to hold or use the objects. There can be a random involuntary movements, arms and legs move around in an unpredictable way, and a person can have a combination of these involuntary movements. There may be arms and legs are moving in a random way, and at the same time, part of her body is twisting into these unwanted or uncomfortable positions. Only one hand or a leg can be affected by the unwanted movements. They may use other hand for the eating and writing. They can walk around okay, but they have some trouble on uneven surfaces. If more body parts are affected, like arms, legs, neck, muscles in a face or throat, these extra involuntary movements can make it very hard for the person to stand, walk, eat, or even speak. So movements may be slow, they may be fast, jerky, continuous, rhythmic, twisting movements. Next is the atasic cerebral palsy. The less common type of cerebral palsy is the atasic cerebral palsy, in which a cerebellum is damaged, affected, impaired, or the underdeveloped. So cerebellum, a balance center of our brain, help us to fine-tune movements that we want to make. So when cerebellum or a balance center is damaged in someone with a cerebral palsy, this results in a shaky and unsteady movements. Atasic movements are characterized by the clumsiness, instability, movements that are not smooth and may appear disorganized or uncoordinated. So, if this shakiness is affecting muscles in the arms or the hands, this makes it difficult for using and grasping objects. If someone with a cerebral palsy has shakiness in the legs, they widen their legs while standing or walking. This shakiness does not always affect the arms or the legs, but also affect the muscles in the face and the throat and even in the eyes. So this makes it very difficult for the person to swallow, speak, or quickly changes their eye positions where they want to look. So if they have a mild impairment, they can walk around by using a crutches or a walkers to keep their balance. But if cerebellum is more damaged, more shakiness is present, and they might need the wheelchair.